And good afternoon, everyone. This is Art Shead with the Shead Group, and today we will be discussing the Medicare Fast Facts of 2017. These numbers are important because they set the trend for what we can expect to see in the Medicare system. So across the top, we got the top line numbers, and across the bottom, we're dealing with the year in the life of a Medicare recipient. So with that, going any further into a great deal of detail, let's go ahead and jump right into it. First and foremost, top left-hand corner there, you see there are 60 million people in the Medicare space. So that's 1 in 5 Americans today. 60 million of them have Medicare. 50% of them have incomes of 26,500 or less. All right. The next item is pretty big because when it comes to chronic conditions, 44% of them have at least 5 chronic conditions. As your chronic conditions go, so does the quality of life. All right, so keep that in mind. We won't dwell on it. Next, this is equally as important. 34%, or roughly a third of everyone in the Medicare space have some form of cognitive impairment. Read the tea leaves on that, people. That's huge, especially if you consider that there's 60 million people in the Medicare space, and there are roughly 8 million long-term care policies active out there today. All right, so there are a number of people who will need some form of assistance, and individuals in the cognitive impairment side will need it more than others, okay, when it comes to basic living and long-term care. And Medicare doesn't cover long-term care. I'm not going to hit that any harder. So moving along. 9% are individuals under the age of 65, and of course, 12% are responsible for roughly 57% of all the claims out there. All right. A lot of that is going to be Part A claims. Think about that. All right. On the bottom, again, this is the year in the life of a Medicare recipient. When it comes to Medicare, for the most part, majority of you, guess what? You're doing exactly what you're supposed to do. 77% of you are just going back and forth to your primary care doctor, your specialist, in order to manage those chronic conditions, right? So that's what you do year in, year out. That's it. 77% of you, that's all you're going to do for the year. Go back and forth to your primary care doctor. 28% of you will end up in an ER room, all right? 23 hours or less. This is a Part B service, all right? Why is that important? Because this is where, again, you receive the most in the way of Medicare protection. Medicare pays 80%. Your responsibility is 20%, just because you're paying that premium for Part B. Remember that. So there will be a small percentage of you, 28% of you, that will end up in an emergency room, all right? And it will be a Part B service. All right, next to it, inpatient hospitalization stay. 19% of you will have some form of a hospitalization. Why do I say will? I mean, this is 2017, but this is 2019. That's been the trend for the past few years. Okay, so these numbers have pretty much held pretty steady. So 19% of you will have some form of inpatient hospital stay, which would mean you are hospitalized 24 hours or more. Could be inpatient, could be observation, could be for skilled nursing rehabilitation. Part A services. Remember, on the Medicare side, this is where you're going to spend the most in the way of money. Part A. All right. And then, of course, next to that, home health services, 9%. Guess what? You leave the hospital, you're still not 100%. Don't need to go to a skilled nursing facility, or maybe you went to a skilled nursing facility and now you're back home. 9% of you are going to utilize some form of home health care service. Why are these numbers important? Again, they set the trend, right? And as they set the trend, it allows us to put together a strategy, okay? So based on your level of utilization in those key areas, Part A and Part B, we can put together a healthcare strategy that will work best for you. So these numbers deal with that red, white, and blue card, right? We haven't even talked about purchasing a Medicare supplement or Medicare Advantage plan, but that's part of the discussion, all right? And then there's a wider discussion that we need to have. This is point number 2. You know what? You rely on your trusted advisor, that being your CPA or your wealth advisor, and you've relied on them for a number of years. And guess what? They have done a great job. All right. Now you're retired, or now you're thinking about retiring. Okay. At this time, we want to work with your trusted advisor in order to put together a strategy, a healthcare solution for you that will keep your healthcare issues away from your income and your assets. We need to take your healthcare concerns and basically put it on an island all on its own, thereby protecting your income and assets going forward during retirement. We can do that. We are, again, the Shead Group. We want to sit down with your CPA and your wealth advisor in order to discuss strategies that will benefit you. And guess what? We can provide up to $500,000 worth of protection for an individual. Okay. If you're a couple, that's $1 million in the way of protection. Think about that. Okay. We could do that in most cases without having long-term care. Think about that for a second. So again, we are the Shead Group. We are done for the day. Reach out to us, 317-965-0261. That'll reach me directly, or the office number, 1-888-969-7822. Hope you enjoyed the presentation today. And of course, we look forward to the next one.